Ladies and gentlemen, we are back again with our presentation and webinars. Very important topics actually. Our last topics. Associated Professor Dr. Hayati Aygun from MEDICABIL Hospital will gonna share with us the latest improvement at endoscopic spinal approach surgeries and treatment. Please, Doctor, the floor is yours, and share your experience and your treatment method with us.
Thank you very much, dear President. Good evening, everybody. I know all of you and us is tired now. I will present as possible as fast.
Oh, please take your time. You have 30 minutes, so you can take your time.
This is my presentation plan. I will talk about the endoscopic spine surgery. Now, here is the endoscopic spine surgery role of on the spine diseases. As a definition, the spine surgery means that the surgeon eyes inside the patient, inside the surgical field. The inside visualization of the surgical field means that, you know, the conventional surgery, we are looking from the outside of the patient to inside the surgical field. But in endoscopic visualization, the surgeon, in another word, we can say that the surgeon eyes inside the patient. Now we are performing all these procedures, but we added to the endoscopic procedures to our conventional spine surgeries. Why we needed to endoscopic surgery? Because the open spine surgeries, we are performing in many years, of course, and it has very high successful rate, but also it has some disadvantages, especially after surgery, the patient has complained about the chronic pain. The chronic pain causes from some open surgical properties. Because of this, the endoscopy playing a role day by day, widening the endoscopic surgery in spine diseases. Because the endoscopy can protecting of muscles and the facet joints and joint capsules. Shortly, we can say that the endoscopic approach can protect the patient crucial structures. In this literature, you can see this many of disadvantage of open surgeries, especially after surgery. You see here some muscle degenerations. So in the literature, we saw that the endoscopy clinical results are comparable to microsurgery, and in many of diseases, it's better and superior results we can get with endoscopic surgeries. The endoscopic spine surgery targeted to increase the benefit zone with the less traumatic surgery accordance to all the spine segments, and it can be available for deformities, and we can do segmental fusion without open surgery, and also we can make enough decompression than open surgeries. Okay, now in this table you see that many of different endoscopic techniques. In our center, we are performing almost all these endoscopic approaches and the different techniques. Currently, we are also doing almost all the disc surgeries with endoscope, and almost all stenosis surgeries, and some selected cases also it's possible to make instability and deformities. But in recently, we have some new developments in spine surgery. For example, we can add the anterior approach, and we add it to the posterior laminotomy, decompression, and for some tumor cases, some spine tumor cases, secondary or metastatic cases, we can make endoscopic debulking for tumor cases without open surgery. And the posterior laminotomy and laminoplasty is very new step for the endoscopic spine surgeries, but it's the application apparatus under development by us. In also thoracic and lumbar regions, we have many new endoscopic approaches. You see here, this is the conventional open microscopic surgery. Most of surgeons seeing that the full closed surgery is not true. It's open, it's kind of open surgery and microsurgery. You see here another endoscopic surgery and another type of endoscopic surgery. No bleeding and clear visualization, you see. So we have some problems in the spine surgical area, you know. The main, we have some major problems actually. The fibrosis and the relapse of the diseases, we can say, and to reduce these complications, we are using the again endoscopic techniques. Here you see we are adding to the non-manipulative surgery, developed non-manipulative surgery to reduce the fibrosis formation, and we are doing annular dilation to protect the innocent tissues, and we are using the biorepair materials to enhance the healing of the disc material after the surgeries, and we also adding some anti-adhesion barriers to protect the patient from the fibrotic formations. And also we have some another new approaches, the flavum sparing approach and flavum repairing and endless repairing, but it still needs more development. As a new and latest and the last generation endoscopic technique, nowadays we are using the UBE, unilateral biportal endoscopy mostly. It has very big advantages. For example, it has it provides very clear and safe surgical area for surgeons, and we decrease the indirect approach, and we increase the direct approach with this technique. And also we can use the assistant as an actively. It's different than the other endoscopic techniques. And newly, we as I told you before, and we add the flavum sparing, flavum repairing, non or minimal manipulative surgery is the upper than the microsurgery, and you'll be following the target-oriented approach to make a specific minimal invasive surgeries. Now you see the kind of endoscopic discectomy case. This area is just 1.5 centimeters square area. We are seeing very clean and seeing very safe surgery. You see here, we are creating a just 3 or 4 millimeter flaval defect to access to our target point. You see now, I want to shorten this video. Now you see here, we create a hole inside the spinal canal. Now we see in the spinal cord, and we never touch the epidural interface tissues epidural surround tissue interface because it can cause development to fibrosis. You see here, very safe, and we created to the a little hole without touching the crucial structures. All these other structures is in innocent tissue, so we don't need to touch all this. Now we are removing the disc herniation with very small hole. Now, just here. Now we are starting to remove this part from the spinal canal. If you notice that there is no bleeding and very clear and safe surgery now. You see, it's to make a mistake almost impossible with this technique. Now remove the disc herniation without touching any innocent tissues, you see. Even very, very small blood vessels can protect with this technique. Yeah. These patients can go their home after surgery in a couple of hours, for example, 3 or 4 hours. He can or she can use their cars. They can okay, you see here just 3 millimeter. I will show you 3 millimeter and 8 millimeter hole is enough for this big surgery. Now after surgery, you see here the disc herniation in MRI, and after the MRI, very clear. Here is our surgical way. This is immediate MRIs. And also we are following the new developments, as I said. We are trying to make endoscopic annulus repair to prevent the re-herniations. Also in the near future, maybe the nucleus pulposus implants we will use, and we are using the bio repair enhancers, and also the gene and cell treatments will offer a chance to healing the disc herniations after surgeries. Also, we can perform the re-herniation or revision cases with endoscopically. This is the re-herniation cases. You see here, in open surgeries, it can be a dangerous for patients because the nerve roots or neurological tissue injuries can be seen in the classic surgeries. But you see here in endoscopic visualization, it's very clear, no bleeding, and we can reach, we can access without any obstacles, and we are using the very high definition video assistance, and also we can use the classical surgical tools. So this technique also very cheap than open surgeries. Now you see here, almost completed to the revision surgery with endoscopic technique. In stenosis, you know, another major problem in the spine area, the spinal stenosis. Also, we are using for stenosis surgery the endoscopic techniques. Why? Because endoscopic techniques can make very good lateral recess decompression, and we can preserve the crucial stabilizators. and we can prevent the muscle fibrosis, muscle formation that it can cause the chronic pain after surgeries, after open surgeries. Also in microsurgery, there is a severe muscle degenerations, and we can use almost all the kind of endoscopic spinal stenosis. Also, we have three kind of endoscopic technique, but mostly we are using the last generation UBE decompression technique. The UBE has big advantages, I said before. It's a last generation endoscopy, and we are using the high technology for this. And we can use the special instruments. Besides the special instruments, the conventional open surgical tools can be used in this technique. And according to the literature, as you've seen this, the UBE is better than the other techniques. And this is the UBE sequences. I will show you a sample, and I want to talk on a case. This case was 68 age male. He had diabetes mellitus and the hypertension and the cardiac problems. He was very risky case, and also he had very high pain scores. And this is the radiological pictures you see in this here in MRI, very severe 2-level stenosis. This case, endoscopically, we did endoscopic decompression. Now I will show you the nerve roots. Here is the contralateral side nerve roots. This kind of surgeries in open surgery is very bloody surgeries, and also we mostly these cases need the screw rod stabilization. In other words, the surgeon use the stabilization for these cases, but in endoscopy, we don't need to touch the crucial stabilizers, crucial tissues, so we can make very successful decompression without any stabilization procedures. And now I will show you here. This is the spinal cord and the nerve roots and the contralateral side nerve roots here, just here. In just one side, we can make foraminal decompression. After surgery, you see here the decompression. This is the before picture and the after surgery. All these pictures belong to immediate MRI. Very good decompression you see here. This is the spinal canal, previous and after surgery. Previous and after surgery. After surgery, you see the skin incisions. After healing, just 1.5 centimeter and or 0.5 and 1 centimeter incision is enough to make like this big surgeries. Also, we can make endoscopic stabilization with this technique. Also, we are using the UBE because UBE, according to the literature, UBE has big advantages than the other techniques. Again, another young case. This case operated by open microsurgery 2 times. After 2 times operation, when he came to our hospital, he was not walking, and he was suffering from very severe pain and neurological deficit. You see here the post-operative pictures, and this is the surgery. We did endoscopic re-herniation removal, and then we did endoscopic. We put the endoscopic pellet cage, this case, and then we add the screw fixation. All this surgery was done by endoscopic technique. Of course, it has some complications and some disadvantages, especially the learning curve very long and high in this technique, but we are using in high rate success in our center. Thank you for your patience.
Well, thank you very much, Dr. Hayati, about a very informative and very wide range of information we have got from you today about spinal surgery, endoscopic technique, which is very important to do it, because otherwise, if it is with a very old technique, the patient need to spend several days in the hospital. Yes. And then several weeks, maybe month, stay at home and no drive, no walk, just have a laying down and rest. That was old method and technique. So nowadays, thanks for your new generation of treatment in this subject, which you allow to return back to the life comfort zone very soon. Thank you very much. And I received a lot of good comment from the listener. They are thanking a lot, and they are saying that all information is, there's one question, right? One question in the last minute. Okay, let me check. All right, so yes. This is a question coming that is hip replacement performed by a robot?
Yes, of course. In our center, the hip replacement performing by robot-assisted surgery.
Robot-assisted.
Yes, in our arthroplasty center.
Okay, yes. So this is
hip and knee. Mostly they doing robotic surgery. Good.
So we got one question. The rest of the listeners today, they are thanking a lot, and they said that we are very much benefit with very open and transparent presentation, which you show all your technique and details, how you really operated. Thank you very much for your transparency.
Also, we are presenting for the patients because they deserve it. For patient education, very important for us.
Thank you very much. Thank you, doctor. And we hope that we can see you soon in Bursa, inshallah, in our visit, next visit. And we are proud of you that you are performing really amazing operations and giving back the comfort to patients. Thank you very much for contribution and for participation.